Okay.
I would like to talk to you about bleaching, Dr. Chiu. I think there are maybe three different ways, more or less, three major categories a person can go about it. One would be buy bleaching trays or bleaching strips over the counter and do them. The other one is do similar custom-made bleaching trays in a dental office such as yours. And the third one would be to take some of the new laser type of treatment, which take only a half an hour or so, and you walk away with white teeth. Now, tell us a little bit about those three in terms of what advantages / disadvantages, including, maybe pricing. I assume the over-the-counter is the most inexpensive, but maybe I'm wrong. Shed some light on those three areas a little bit, please.
Sure. Well, the bleaching systems that you can buy over the counter are relatively have very low concentration of the active ingredient to whiten your teeth. They do they do whiten teeth, maybe a few shades here and there, but you're not going to get a lot of very good results because of the concentration of the active ingredients. The ones we provide in dental offices, such as the chair side, where we provide in the bleaching in the office for about an hour, we can achieve 6 to 10 shades lighter within an hour. It is also the take home is also very effective. It's a high concentration. We use custom trays where you are able to use a high concentration of the active ingredient to whiten the teeth. Let me
ask you something. You mentioned you pointed out a custom tray. So basically it fits much better your teeth, and the reason you can use a higher concentration is so that nothing comes out around your gum, or when you go over the counter, those trays are not quite fitting so custom, and some of that gluey thing which you put in might come on your palate and on your cheeks. Is that true?
Yes, it's very true. That's why they have to use a low concentration, just because that gel is going to go everywhere in the mouth. By having a custom tray, we're able to contain the gel into more precise area where it should be to whiten the teeth, and that's why you can use a high concentration. Same thing on the chair side, the one we provide in a dental office, we actually have to isolate the gums so that we can provide use a much higher concentration to achieve a greater result in a short period of time.
Okay. Now, once a person has done any one of those bleachings, be it the custom tray or the over-the-counter, and let's just say especially the Zoom one. Personally, to me, the Zoom would appeal the most if I would consider something like that, simply because I'm one of those guys, who wouldn't take orthodontic treatment, the Invisalign, over a veneer. I would say grind them down, put my veneer on it, because I don't want to wear anything for 6 months. Not because I'm embarrassed by wearing it. It just I like things tomorrow. I'm one of those hyperactive type of guys. If it's possible to be done in one shot, you do it in one shot. But that's me. That doesn't mean this is better at all. So either way, whatever bleaching one does, can those bleaching be redone? Let's just say a person most likely has yellow teeth because he smokes, he drinks, he coffee at least, things like that. Red wine, I hear stains. Anyway, whatever it is, most likely a person isn't going to change his lifestyle because he did a bleaching. So he will get brown teeth again, like we get dirty again. Can he then do it again? Or does the tooth only support this whole thing once or twice?
Definitely you can do it as many times as needed to keep your teeth white. what we usually do is you provide a touch-up kit where, you can do it at home. And whenever your teeth get stained again, which will happen if you smoke, drink, coffee, or tea, it will stain back again. So with the touch-up kit, you can maintain it white. You just wear it every 2 weeks or every month, depending on how much the color returns, and to keep it white.
Okay, good. Now, if people do it at home and their teeth have some cavities or some other, some type of stuff going on, is that kind of a handicap, or is there something they need to take care of and be careful of, some pre-existing condition before they try it at home?
Yes, definitely. You do want to see a dentist before you decide you want to do a whitening. You do not want to bleach teeth that has cavities or other problems, dental problems. So definitely have a dentist look at it before you decide to do any type of bleaching.
I see. So go get your teeth basically, for instance, should you have a cleaning done before you attempt bleaching? Because otherwise all you do is you bleach the calculus on it or something like that.
Yes, that's correct.
Okay, good. Well, wonderful. Thank you very much again, Dr. Chiu.